Can we start, sir?
Yes, madam, please start.
Welcome back, everyone. We are delighted to welcome our next esteemed speaker, Dr. Sadaf Khateeb, ma'am, Medical Officer at Indira Gandhi Government Medical College and Hospital. Ma'am is having 25 years of rich experience with couple of reputed publications. Today, she will enlighten us on the respiratory system in the line with our FDP theme on intelligent healthcare systems. Ma'am, we can proceed the session.
I hope the screen is visible to all.
Yes, madam.
Good evening, everybody. Myself, Dr. Sadaf Khateeb. I am serving in Nagpur Municipal Corporation as a medical officer for National TB Elimination years. So before I start this session, I would like to extend a big thank you to Anjuman College of Engineering and Technology, especially the Computer Science and Engineering Department and the organizers of this faculty development program for inviting me here. My heartfelt gratitude to all. As we all know, artificial intelligence is a technology that enables simulation of human behavior and skills. Without an iota of doubt, this technology supersedes humans on many fronts, especially data analysis and automation. But it simply cannot replicate or replace the uniquely human qualities of creativity, ethical and moral decision-making, and of course, the emotional quotient. Humans are certainly the most superlative creations of God. I can therefore comment with full confidence that artificial intelligence can only augment human capabilities. It cannot replace humans. Birth and death is one cycle for humans. The only constant in this cycle is the change that one experiences during the lifetime. So, change is the only constant, and any change is almost always met with resistance. Same is the case with artificial intelligence, more so in the field of medical sciences. Artificial intelligence has made stupendous inroads in our daily lives. So healthcare also is trying to incorporate this technology now. In this session, I would briefly delve into the applications of artificial intelligence in the various clinical and non-clinical branches of the medical field. So my talk includes the applications, and at the end, there would be a brief comment upon the limitations and the challenges in the general aspect, not only restricted to the medical field. So beginning with one of the branches of medical sciences, that is cardiology. Here, artificial intelligence plays a role in ECG analysis, cardiac imaging. ECG, the electrocardiogram, is the most basic investigation advised for cardiac evaluation. The AI algorithms help in detection of abnormalities in the ECGs. As you can see in the picture with this normal sinus rhythm, the projections are at regular intervals, the waves are in sync. So the heartbeats are in the normal range, up, the heart is functioning in the normal way. Cut to the next slide, the next picture, atrial fibrillation. You can make out the difference. The projections are irregular, means the heartbeats are not regular. They are too fast. At times, there is a skipped beat, and the waves are not completely formed. So here we can very safely interpret that the heart rate is not normal, as well as the functioning of the heart. The other parameters are also not functioning properly. This is based on the simple ECG. Now coming to cardiac imaging. Cardiac MRIs with automated measurements can provide precise and detailed information on cardiac structure and functions. What does this mean? The MRIs, magnetic resonance imaging, when these techniques are performed, they have automated measurements. In-fed data is there with the size of the heart, the muscles involved, and the functioning of the heart. How solid is the contraction? How good is the pumping of the heart? There is a catch here. Imaging techniques in a functional organ, in a moving organ, always has its restrictions, limitations. So the cardiac MRI human interpretation may vary, and here the AI mode helps in accurate interpretation of the results. Cath lab procedures. Machine learning combined with expertise of interventional cardiologists can increase precision in the procedures like coronary angioplasty. I don't think any special or difficult terms are being used here. Coronary is anything related to the vasculature of the heart. Angioplasty is something everybody has heard about. As you see in the picture, the arrow mark, angiography is the procedure through which the diagnostic procedure is the angiography and the treatment mode is the angioplasty. In this procedure, a guide wire is passed through the arteries, preferably from the arm. There are other sites from where the guide wire can be passed, that is the legs or the neck, but the most preferable site is the arm. Dye is injected through the arteries, and this dye spreads out through the blood supply in the whole of the heart. As you can see in the picture, there is one spot marked by the arrow where there doesn't seem to be any dye. It implies that the blood circulation has a blockage there, so the dye has not impermeated to that part. Rest of the part seems to be flushed with blood. So this block is to be removed through angioplasty. The procedure done was angiography. The guide wire passed through the artery has a balloon on its tip. This balloon is inflated, and with that inflated balloon, this block is burst or torn into small pieces. Those fragments are flushed out by the blood. The blood vessel becomes patent, and there is space. The blood supply gets back to normal. Once the block is dissipated, the symptoms of the patient are reduced, and a normal supply starts flowing in the heart. So as I said, here machine learning has a major role to play, and angiography is the procedure through which the angioplasty is done. It can be a single step procedure. Now, risk prediction and early detection. ICUs are places where risk prediction as well as early detection of disease is of utmost importance. So large data sets can be analyzed by AI models to enable early detection of diseases and also the risk of sudden cardiac death. The data sets which have been analyzed give early indications which patients need more monitoring, which patients need what kind of management. how long will be the duration of their stay in the ICU, and which patients have poor prognosis. All this is analyzed by the AI models, and this can help in risk reduction, more so reduction in mortality. Moving on to AI in pathology and microbiology. These are non-clinical fields. Pathologists and microbiologists don't come in immediate contact with the patients, but they have a major role to play in the diagnosis of the diseases. Pathology and microbiology both give diagnostic avenues. And here the scope of AI is humongous. With pathology, we have digital pathology, automated diagnosis, genetic therapy. In digital pathology, slide imaging, tissue classification, cancer subtype recognition using convolutional neural networks. Of these, slide imaging, tissue classification, pathology is based on testing of samples. And what is the sample? The sample could be a tissue, could be a body fluid from the affected part. A few milliliters of sample is collected, slides are prepared, and those slides are then viewed under the microscope. This is done on a human ground, I'm saying, where pathologists are functioning. But with the role of AI, number of slides that have to be screened, viewed, reported upon is so large that it's very time consuming. But with the CNNs, with the AI modules in place, the time is very much cut short, and the accuracy, the precision of the AI input is excellent in pathology. Automated diagnosis, computer-aided detection of cell morphology. This again comes with the slide imaging, where the slide is seen and interpreted. The slides have tissue or whatever the material, body fluid is provided. The cells inside that body fluid or the tissues, their morphology is seen. Morphology, their structure, how is their cell wall, how is the nucleus. And if there is any abnormality in that cell morphology, that relates to a certain disease, which can be automatically picked up by AI. Genetic therapy. By integrating data from DNA sequences, genetic expression, and clinical records, AI enhances diagnostic accuracy and automates complex tasks. Since I've been working in the field of tuberculosis, genetic therapy is one where DNA is targeted. So when tests of blood samples, or not exactly blood samples, I would say tissue samples or the sputum samples, tuberculosis majorly affects the lungs. So it's pulmonary tuberculosis. And the tuberculosis affecting parts other than the lungs is the extrapulmonary tuberculosis. If it's an abdominal TB, we have to collect sample from the abdomen, which could be in liquid form also. So here, these samples are processed, they are run in a machine where genetic DNA sequences are targeted and the diagnosis is made. It is often said, performance of artificial intelligence often matches or exceeds human pathologists in accuracy and tact, turnaround time. As I said, humans will take a longer time, and AI cuts down on the time consumed to come at a diagnosis, to give an interpretation. As you see on the slide on the left, picture on the left side, the blue cells are the normal cells. A very nice, well-rounded cell, proper membranes with the completely, with finesse, one can say, it's rounded and all intact. Once there is a change in the cell morphology, it could be because of cancer. If it is because of cancer, the morphology how it changes is seen below with the red color. The shape of the cell goes haywire. The nucleus disintegrates. And when there is cell multiplication, it is in a big way. They divide very fast and they break down faster. Now, switching to the next picture, everybody must be wondering, what is this picture of Angelina Jolie doing here? To the unintroduced, Angelina Jolie is a Hollywood celebrity. To her name, to her credit, in a way, in healthcare is the Jolie effect. A little bit back into the history of Angelina Jolie. She has had family history of breast cancer. Somebody in the family had breast cancer. She herself got evaluated. She got herself investigated. And it was found that Angelina Jolie had BRCA1, breast cancer 1 gene. Now, this gene, if present, has very many chances of developing a mutation. And once the gene mutates, this BRCA1 gene, if this gene mutates, there is, by AI analysis, it has been predicted, there is an almost 80% chance of developing breast cancer and a 50% chance of developing ovarian cancer. Now, here comes the Jolie effect. What did Angelina Jolie do? She was detected with BRCA1 gene. She, as an adult, took an informed decision, consulted her physician, and she got herself operated. Now, see here, the gene was there in the body. It hadn't mutated. But with AI predictions, there were chances of mutation which could have led to breast cancer and or ovarian cancer. So, in the year 2013, Angelina Jolie got herself operated upon. She had a bilateral mastectomy done. Both her breasts were removed. Later on, she also got her oophorectomy done. Both her ovaries were removed. It was her own decision to avoid the complications when the gene mutates, which has, as the AI analysis had said, almost 80% chance for breast cancer and 50% chance of ovarian cancer. So, to prevent those complications, she took a precautionary measure and underwent surgeries which could prevent any further deterioration despite the gene being in the body. So here is the role of genetic therapy. And with this step of Angelina Jolie, awareness of breast cancer and ovarian cancer spread in the Western society in a huge way. She was bold enough to come out in the public domain, accept the presence of the gene, and openly disclose her decision to go ahead with the surgery. This is on an individual basis. In the Indian scenario also, people have started. It's not exactly mandatory, but middle-aged females, especially females who have had family history of cancer, especially breast cancer, they are advised to undergo screening tests to avoid, so that intervention can be done at the right time, so that complications can be avoided. Now, moving to the microbiology part, microbiology is one sector which deals with the microbes, the pathogens, the disease-causing organisms. These could be bacteria, these could be viruses. Very recently, we had a very bad experience of coronavirus. So microbiology also has a big role. AI has a big role in microbiology. Diagnostic acceleration and predictive analytics. First, we talk on diagnostic acceleration. Machine learning for rapid identification of pathogen automated prediction of antimicrobial resistance. To break it down, I would give an example of my field, the tuberculosis, rapid identification of pathogen. As I said earlier, with pulmonary tuberculosis, the sample tested is sputum, coughed out by the patient. If another body part is involved, say there is a lump in the neck, sample is aspirated or tissue is taken out from that lump, and that is processed and subjected to a test. One of the tests, a very modern state-of-the-art test, is CBNAT, cartridge-based nucleic acid amplification test. This test gives an automated report, auto-generated report within 2 hours of testing. So this is a big achievement. Once the sample is processed, it is loaded onto the machine. The test is auto-run, the DNA is targeted, and the report is auto-generated. The printout is taken out, and we get report with 2 parts in it. First is identification of the pathogen, of the mycobacteria. Is it present? Is it not? If the mycobacteria, TB mycobacteria is present, the report says Mycobacterium tuberculosis detected. The other half of this report says the bacillary load. Is the bacillary load, the number of bacteria, is it very high, medium, low, or very low? This is one part of the report. Now the other, prediction of antimicrobial resistance. If we get a report that Mycobacterium tuberculosis is detected, we have microbiological confirmation, we have complete proof that this disease is tuberculosis, we need to start the treatment. That is the basic drug-sensitive treatment for tuberculosis. Treatment can be initiated, but the other part, resistance, can also be, I would say, generated or displayed by the second half of this report, which gives the report of resistance seen or not. Resistance of what? The drugs given for TB. Are they susceptible? Are the mycobacteria susceptible to these drugs? These drugs will act on the mycobacteria and kill the mycobacteria. Or else the other part is the resistance. The mycobacteria isolated is resistant to the drugs. Now here the treatment regimen changes. You get the point. TB diagnosed, starting treatment, but if we don't have the resistance pattern, we will be giving inadequate, improper treatment. But if we have the resistance pattern, we will not give the resistant drug to the patient. A customized treatment regimen is made for this patient. So what we see here in the bracket is the whole genome sequencing, where the DNA is targeted, and antimicrobial susceptibility test, the report which shows that the mycobacteria is resistant or susceptible to the drug, is replicated in the printout taken out of the report generated by the machine, the CBNAT machine. What does the difference lie, whether we know or we don't know about the testing, about the presence of pathogen? 10 years before, we didn't have this machine. So the report, one sample, one sent, was tested, and the result that we would get would come in 2 to 3 months' time. So if that is the duration reporting took, you can imagine tuberculosis is a contagious disease. It spreads. The patient has been spreading illness from the time of onset of symptoms till the time we have initiated the treatment. The duration could have been 10 days, 10 months, could be any duration, till we have the report in hand. Back then, it would be 2 to 3 months. So imagine one person spreading disease to 10 people, and those 10 people spreading disease to another 10 people. Where would we break the chain of infection, the chain of transmission? Now back to this technology here in today's date. In 2 hours, we get the report. In that report, we also get the resistance pattern. So a customized treatment plan is given to the patient. 6 months duration for routine TB treatment and the patient is cured. Coming to predictive analytics, outbreak and resistance forecasting. Most of you must have come across this, especially during the COVID times, outbreak of infection. Ever since we have witnessed that COVID outbreak, the surveillance machinery is always on alert now. And especially here in the Vidarbha region, during the rainy season, you must have heard about the dengue outbreak, the swine flu outbreak. So, along with the medical data, which is analyzed by AI, we also have a data of the geographical locations, which can predict the location for outbreaks. As for resistance forecasting, it is more geographically based, I would say. For example, in tuberculosis, we take two cohorts, one from Mumbai, one from Nagpur. Say a patient in Mumbai becomes symptomatic and goes to the health setup, gets evaluated, is diagnosed to be having TB. The patient is initiated on treatment. But the predictive analytics, the AI analysis of Mumbai says there is to the tune of 30% resistance in the mycobacteria there. Coming back to Nagpur, our cohort does not see that extent of resistance. So the drug regimens, the treatments that are given to Mumbai people and to Nagpur people will vary based upon the resistance. At the Nagpur level, the resistance is to the tune of 2 to 3% within limits. 30% resistance, and if you're giving the resistant drug, it will be of no help. The transmission will keep on continuing, it won't stop, and the patient will not recover. There will be other catastrophic costs or complications for the patient. So role of AI does play an important part in pathology and microbiology both. Now, orthopedics. This is one surgical department. The role of AI here comes in the robotic surgeries and the image analysis. The robotic surgeries have made a big name for themselves, I would say, in knee replacement, hip replacement, implant positioning. Here, the navigation systems help the orthopedic surgeons. As shown in the picture, the surgeon sits with his navigation system and the patient is operated upon. Besides, or could be with a distance on the operating table. The results of robotic surgery have been very encouraging in the recent past. Image analysis. Here, orthopedics in collaboration with radiology gives an analysis of the fracture detection, the sports injury classifications, which help in precise treatment or appropriate treatment, targeting the site where it is needed. So in orthopedics also, AI is making inroads. Now tongue twister, otorhinolaryngology. We get it simple? Ear, nose, throat. It is so simple. Just to make it difficult, it is otorhinolaryngology. Oto is the ear, rhino is the nose, larynx is the throat. But we are more concerned with the AI use here. So audiology. Audiology is the tests, audiometry done to know the hearing of individuals. Automated interpretations of audiograms and cochlear implant processing is AI based. Tests are done to assess the hearing capability of the person, maybe a child, maybe an adult, whosoever. And if you take cases of deaf mute children, unable to hear. So when the audiograms are run, a report is generated, which is analyzed by AI. And according to that report, depending upon the type of deafness, could be sensory, could be neural, whatever, the cochlear implant is selected so that the person starts hearing again. Imaging analysis is again radiology based. Here, deep learning is used for laryngeal diseases. Just see, more than 90% accuracy in tumor detection. This is hugely significant. If the accuracy is more than 90%, detection is easier and treatment can be initiated at the earliest. And for cancer treatment or whatever treatment, the earlier the treatment is initiated, the better is the outcome that we get. Ophthalmology. AI for screening diabetic retinopathy and macular degeneration, iris scans, glaucoma screening, refractive surgeries. All these parts of ophthalmology use AI. Now, diabetic retinopathy and macular degeneration screening. We have a picture of retina here. Retina is that part of the eye which is at the back of the eyeball, which formulates the images, which reflects the images. You can see the normal retina on the right side, nice, shiny, and it can reflect all images, form images. Vision is absolutely normal. Come to the left side, the diabetic retina. The microvasculature, the blood supply here gets disturbed, anomalous. Why? Because of uncontrolled long-term diabetes. And unfortunately, India is the diabetic capital of the world. People feel proud coming first in competitions, but this is something not to be felt proud about, despite being first in the world. These are the number of diabetics we have, and most are uncontrolled long-term diabetics. So regular screening of diabetics is very essential. Regular screening will help in retaining the eyesight. With uncontrolled diabetes, the retina gets damaged. And if the retina is damaged, depending upon the extent of the damage, the vision is affected. Before one goes blind, we should always have access to the screening techniques, modules that are available locally. Iris scans. Iris is that part of the eye which gives color to the eye. We often say she has blue eyes, somebody has dark brown eyes, somebody has black eyes. This color is the color of the iris. Iris scans, these are unique to every individual. Now, iris scans, rather than healthcare, you all have experienced this. It is in Aadhaar card. One goes to get the Aadhaar cards. Iris scan is done for everybody. So there also it is used rather than medical healthcare setups. The other is glaucoma screening. This is a very big reason for blindness. Glaucoma goes unnoticed. Glaucoma is the increase in eyeball pressure. That can be screened to prevent complete blindness. Here also, AI has a major role. For refractive surgeries, refraction is, you see often children in the schools having glasses, visual problems, cannot see nearby images, cannot see distant pictures, myopia, hypermetropia. Glasses were given, still are being given to correct these refractive errors. But now AI has taken has been introduced to correct these refractive errors and get refractive surgeries done to correct the vision. So when in earlier times we would see elderly people with thick glasses, those glasses are no more required now. Lenses will help, or refractive surgeries can increase, may improve their visions. Dermatology. AI applications in dermatology, skin, cancer detection, and multi-lesion analysis. As I've already said, analysis and automation is something which humans just cannot beat the accuracy of AI. It is so good, so accurate, so precise. Now, melanoma or non-melanoma identification using convolutional neural networks. Melanoma is the skin pigment. When the skin pigment, that gives you the color. Somebody is fair, somebody is dark, somebody is blonde, somebody is brunette. So that melanoma, if it goes down, it is dangerous. If the pigmentation increases, that again can be dangerous. So with AI, identification of cancer, that is melanoma, can be done. And similarly, automated comparisons among multiple lesions and risk scoring. Typical book-like presentations are not seen in the field. When the patient reports to the doctor, to the treating physician, the skin lesions or the symptoms can be varied. So here, the automated comparisons between two lesions is done, and it can be gauged or interpreted by AI whether the lesion is benign, cancerous, or is just reactive and will go away with time. So this is how AI works in dermatology. Neurology. That is applications of AI in the brain, functioning of the brain. Neuroimaging. Imaging is always related with radiology. So almost all branches have to be collaborated with radiology to come at a diagnosis. Tumor, strokes, degenerative diseases, all these can be commented upon through CNN. EEG analysis. EEG is electroencephalogram. It is a study of the brain and a study of the signals coming out of the brain or moving inside the brain. This can be a predictor for seizures. Now, seizures, in common parlance, one would say, jhatke, fit aate hain. That is seizure. How do they happen? Could be because of some pathology, some brain defect, or could be physiological. So here, AI will predict pathology behind this, and it can predict the signals in the brain when the EEG is done. The electroencephalogram is done. The graph is read, analyzed by AI, and a prediction is given that the activity of the brain shows that this person may land up with seizures, that this person has having epileptic fits. So this is the medical implementation of, incorporation of AI in neurology. AI-driven simulation is making way in neurosurgeries. It has just started and may have a long way to go. Nephrology. This is something which is related to the kidneys. Complex data analysis by AI models can predict risk of CKD, chronic kidney disease. Chronic kidney disease of long-standing duration. So these models can predict the risk of disease and the risk of hospitalization. So once the risk of disease or hospitalization is predicted, we get time for preventive and proactive interventions. Now, why CKD? Chronic kidney disease is more significant in our setups because, as I said, India is the diabetic capital of the world. And with long-standing diabetes, the kidneys will be affected. With hypertension, the kidneys are the filters of the body. Hypertension, the filtration of the kidney goes haywire, and the kidneys develop some anomalies which brings down the filtration or the cleaning mechanisms of the cleaning qualities of the kidney. So here again, most of you must have come across diabetic patients. Few of us here sitting, listening to this talk must be diabetic, and they must be undergoing a regular screening test, a simple creatinine test. So based on these tests, the AI models help, along with the lab results, the genetic information and the imaging, the radiology of the kidney, that helps in the prediction of kidney disease and hospitalization risk. Frequent screening is essential to gauge the seriousness of your illness. Never take these things in a lighter vein. These risks later can lead to serious complications, which could have been avoided with your frequent screening at the right time. General medicine. AI algorithms help in image analysis and lab testing, aiding accurate diagnosis and treatment plans. There are very many fields of medicine where AI has a huge role to play in the diagnostic part. When it comes to the treatment part, the medical management, here the AI can only give inputs. The actual treatment, the decision has to lie with the physician. Now, with role of AI in general medicine, we come to mechanical ventilation. Everybody has heard about ventilators, the last-ditch effort to save a patient whose lungs are not functioning. AI-powered ventilators offer real-time monitoring and automated adjustments as per patient's need, leading to improved patient outcomes. When the lungs of the patient are completely knocked down, or they don't have the capacity, the power to breathe, at this moment, the mechanical ventilation helps the lungs. It gives rest to the lungs, and mechanical ventilation helps the patient to be alive. Over a period of time, when the lungs regain their capacity, their power, mechanical ventilation can be weaned off, the patient is stabilized, and with further stability, the patient is moved out of the ICU. So mechanical ventilation with AI power is so essential because it makes auto adjustments. Each patient's requirement is different. For example, one patient may need 2 liters of oxygen and the other may require 4 liters of oxygen per hour. So these adjustments are self-made by the ventilators, and the treating physician has only to monitor them. Radiology. This branch of medicine, of healthcare, I would say, has the largest scope for AI, be it automated detection, image quality. Like detection could be cancers, could be strokes, could be fractures. Once we get these pictures, reconstruction of these pictures using GANs, if I'm not wrong, I don't know the correct pronunciation. It is the generative adversarial networks, 2 networks working simultaneously. The generative network gives command and some data is generated. The adversarial network Adversary is usually the enemy. So the adversarial network comments upon the data generated, whether it's fake or real. So that image is reconstituted, interpretation is given by the AI tool, and a diagnosis is achieved. Deep learning algorithms in CT scans for detection of lung cancer and pulmonary embolism. The role of CT scans empowered by AI have made a huge impact on detection of lung cancer. They have huge accuracy and precision in the detection. Other than lung cancer, it's pulmonary embolism. Pulmonary is related to the lungs. Embolism, it could be any foreign material, could be a blood clot, could be a tissue part, which has broken from its part and is flowing in the bloodstream. If this gets impacted in some major vessel, the blood supply will stop, and the cardiac and the respiratory activity will completely stop, and the patient will land up with a very bad prognosis, which can often be fatal. So here again, AI helps in early diagnosis. AI-based solutions for mammography have increased diagnostic accuracy of radiologists. Mammography is basically the ultrasound or some further sophisticated tests for the breasts. Here, the AI plays a major role and brings down the workload of the radiologist and helps in early detection of cancers. Cardiac radiology is particularly challenging. As I said earlier, a moving organ, an organ in motion, it will have its limitations. A complete picture cannot be interpreted properly by the human eye. Here, AI plays an important role and gives an accurate picture of the cardiac radiology. Current focus of radiology presently is on image interpretation. You interpret the image of the CT scan, the MRI, the slices of MRI, or you see the X-rays. So these are all parts of radiology. With the help of AI, there is significant reduction in the radiologist's burden. And I'll come back to the last part, the immense potential. Before that, I would like you to come to the pictures. Very simple. The CT scan picture, the lesion is highlighted in color, which shows it could be cancer. There is some lesion. It could be a growth. It could be cancer. It could be a lymph node, but it is abnormal. So it has been highlighted. Fractures are so self-explanatory. The bone is broken into two. A self-explanatory picture. Now we come to the X-rays. These X-rays are of the thorax. Thorax, the major organs of the thorax are the lungs, 2 lungs, and 1 heart in between. The white picture in the middle is the heart. The black part is the lungs, the air inside the lungs. Now, in imaging techniques, you see 2 pictures. One, the left side of the picture shows a very big white triangular shaped heart. And on the right side, the shape of the heart is very small. Imagine this picture to be of the same individual. If it's of the same individual, the left side picture, AI will report that the person has cardiomegaly, heart is too big. It is covering almost 2/3 of the thorax. Whereas when you come to the next picture, the right-sided picture, the heart is within shape, it is within its normal range, and the lung fields are clear. There is no cardiomegaly. Now here, the machine is not at fault. The interpretation is also not wrong. Where does the error lie? If we take the first picture, the left-sided with the huge heart, the side part of the thorax is cut. The side part is not included in the picture. So the diameter of the thorax is not complete. Whereas the heart is seen in this X-ray, the diameter is complete. That is one part which may result in a bigger heart, and the diameter of the thorax is not exactly measured here. The other thing could be the person standing who's getting his X-ray done is not standing straight. A little tilt. So with the tilt, the heart is shown in the front and it seems to be a bigger one than the usual size. Heart is normal. The size is normal. But because of the positioning of the patient, it seems to be a cardiomegaly. Now, AI will not be able to interpret whether it's pathological cardiomegaly, increase in the size of heart, or some other error. So here, despite everybody being like, AI will comment what it sees. It's not wrong in commenting and interpreting. But then a physician's analysis is also required whenever there is an anomalous interpretation or some anomaly is detected in the AI interpretation. It should be verified just to come to a conclusive diagnosis, which should be for the good and the benefit of the patient. Now coming to the immense potential in peripheral setups, potential of radiology, AI in radiology. Going to the peripheral setups, say the rural areas, it's very difficult to come across radiologists. Radiologists are very smart. They are concentrated in the city limits with access to all technologies, and with, rather than access, I would say they are with all the modern gadgets to make things easy for interpretation, be it CT scans, be it MRIs, be it X-rays, especially for the X-rays, which are AI read. If this is used in the peripheral setups in the rural settings, it will help in more diagnosis. It will help the patients more. Rather than coming to the city, the X-ray can be scanned and sent for a verification. So this will be very cost effective. So as you see, radiology has a huge role for artificial intelligence. Emergency medicine. This is basically related to the ICU setups, the intensive care unit setups, be it surgical, be it medical. But here, again, treatment part is not affected by AI in no way. More commonly, predictive analytics or the triaging in the sense, which patients need more prioritization, which patients need immediate attention, which patients are at more risk. This again is the predictive analytics given by AI. Somebody is more prone to adverse events. Somebody has a very poor prognosis and may end up dying because of the illness. Somebody may have a prolonged duration of stay in the hospital. Some may not require that longer duration. So in emergency medicine, it is the predictive part which plays a major role. And the other part of emergency medicine is the mechanical ventilation, which I have already described in the general medicine slide. Respiratory medicine. This is one upcoming, or maybe we can say not even upcoming, it has established itself, but AI has an important role, a very important role in respiratory medicine. I've taken a few examples, like for bronchoscopy, EBUS, TBNA, TB diagnosis, polysomnography, and spirometry. I'll go by each point. Bronchoscopy. The airway starts from the nose and goes down to the tip of the lungs. Now, imaging. X-rays give you inputs regarding any abnormality in the lung field. If the patient is diseased and a sample is collected, the diseased lung will always give a sputum sample. Now, there could be so many variations of the sample. It could be white colored, it could be green colored, it could be yellow, it could be mucoid, it could be thin, it could be thick. If we get a sample, testing and coming to a diagnosis is simple. But if the person is not able to bring out the sample, bronchoscopy is one modality which is brought into use. Here, a tube is inserted from the nose. It navigates through the throat, through the larynx, to the trachea. The trachea divides into two parts, the bronchus, left and right. Each bronchus opens into the lungs. So bronchoscopy is navigating towards the bronchus with the help of a tube. It could be synthetic rubber tube. Usually synthetic tubes are used because they are easy to navigate, and flexible tubes are used. Earlier, it would be metal tubes. You can imagine how difficult it must have been then. But now there are synthetic, navigable, flexible tubes. In bronchoscopy, AI is used in navigation and real-time guidance, thereby improving efficiency and accuracy. Such AI-powered navigation systems automatically identify location, hence reducing the procedural time. Lesion is seen in the X-ray. Now, suppose if the lesion is in the right side of the X-ray, each lung is divided into so many segments. Pinpointing that segment and reaching up to that part is a very difficult and time-consuming task. But with the navigation modules, the target is reached in very less time with very little damage, collateral damage. Had it been very little collateral damage means if there is some injury during the navigation, there could be a blood loss because of the injury to the trachea, to the bronchus. This is all avoided majorly with the bronchoscopy, flexible bronchoscope. Extending that bronchoscopy to Ih&Ms TBNA, endobronchial ultrasound, tracheobronchial nodal aspiration. There is some lump in the lung, somewhere inside the lung. It is located through the navigation system of the bronchoscopy. The scope is sent inside. Once it navigates, it reaches the target. A needle is brought out from the scope, a little tissue, or if there is some liquid inside there, that is collected through that scope, and it is then the navigation system helps in collection of the sample, and the tube is then brought out. The sample is sent for testing. This Ih&Ms TBNA is an extended part of bronchoscopy, which has enhanced image interpretation and greater precision in malignancy detection. The camera set on the tip of the tube gives a very good picture of the lung inside, the target, the pinpoint targeted site, and the surrounding area, how much damage is there. It can be very easily visualized. Now, coming to TB diagnosis, I've already mentioned about the CBNAT and the LPA. These again are AI-powered tools which help to come at a diagnosis of tuberculosis so as to facilitate early initiation of treatment. CBNAT is the cartridge-based nucleic acid amplification test, which I described earlier, gives results in 2 hours. LPA takes a little more time. It takes almost 72 hours to give result. But it is equally or maybe a little more sensitive than CBNAT. Polysomnography. Polysomnography is a study of sleep. Sleep study is commonly done for obese individuals who have difficulty sleeping at one go right through the night. They have breaks in their sleeps. The breaks could be because of snoring, which is so common. And very interestingly, the person does not know that he or she is snoring. And the partner there cannot sleep because the person is snoring. So, polysomnography is one test. which is performed on individuals using various wires, various wires. How it happens? It is done at night time, in the sleep time. So that is the duration the patient needs to be admitted. It can be done at home, but under medical supervision, it is better. The sleep pattern is interpreted by AI in the graph that the sleep creates. A person goes to sleep with all the fittings, the wires fitted on the head, the chest. A simultaneous ECG is also being conducted. The person goes to sleep, but the person wakes up. It happens that there is shortness of breath. The person is unable to breathe. Because of that, the sleep breaks. The person wakes up. A few minutes later, the breathing becomes normal. Patient is sleepy, again goes back to sleep. But this cycle keeps repeating. With the break in sleeps, it so happens when the person gets up in the morning, the person is just not fresh because the sleep was not continuous. It didn't give rest to the body as was needed. And similarly, because of the snoring of the person, the partner also couldn't get a proper sleep. So both of them end up having a very bad morning. So here, once polysomnography is done, the sleep pattern is recorded and the AI reads the sleep patterns. It may happen that the tongue, it goes back in the throat and it blocks the airway. Because of the blockage of the airway, the person is snoring and this respiration stops for a few seconds. When the respiration stops, the person becomes agitated and the sleep is broken. So once this test is done, it is interpreted. It can very easily detect events like OSA, obstructive sleep apnea. When the respiratory tract is obstructed, sleep apnea happens, means there is break in sleep. So these are events which can be corrected by the interpretations of AI. The sleep pattern is interpreted. Where is the intervention required? If that is particularly put in place, it may happen that there is very severe obstruction during sleep. So here, the duration of respiratory distress is quite long. In such cases, oxygen is required. And during sleep, with the nasal prongs, oxygen is connected to the patient. The patient has to be put on oxygen right through the sleep. But you can detect this only once polysomnography is done and the results are interpreted and presented. So next time you hear anybody complaining about snoring or inadequate sleep, and if the person is obese, don't be hesitant and suggest to get polysomnography done. Spirometry. This is one test which detects the function of the lungs. How strong are your lungs? How strongly can you exhale or inhale, bring in the air? With a pathogenic lung, with a diseased lung, the strength of the inhaling and the exhaling is altered. So here, a complete breath cannot be taken. The complete breath, the one single breath includes the expiration and the inhalation. That is incomplete. So the patient gasps, or the patient starts, like, as you can say, panting. You've seen dogs, they bring their tongues out and how they pant. Their mechanism is different. Their reasons are different, but it's the same. The respiratory rate increases. That again affects, as it is, the lung is compromised. And with the increased respiratory rate, the lung gets fatigued. So here again, spirometry aids in early detection of disease by automating the time-consuming interpretation of results. In a closed tube, the person is asked to breathe out and breathe in. With these activities, they are interpreted in a graphic mode And those interpretations are analyzed by AI, and they help in identifying the anomalies in lung function. If you consult a respiratory physician, these are tests usually done on people who have had long exposures of smoke. It could be smoking by the person himself, or passive smoking, exposure to smoke from the outside. The person himself has never smoked. Could be the environment, occupational hazard, working in mines, or working daily wage laborers, they break boulders. So the air there is always polluted in a way, one can say. So spirometry is one test which can help identify the strength of your lung, and depending upon the identification and the interpretation of the results, anomalies in lung function can be projected and properly treated. Now, this is something which is not related to the medical field per se. Wearable devices on a day-to-day basis. Blood sugar level monitoring, heart rate monitoring, footsteps monitoring, blood sugar tests. All diabetics or people living with diabetics, I would say, are well aware to test the blood sugar. Prick is given to bring out the blood. It could be a fingertip prick, or a syringe is used to aspirate the blood from the veins. But now we have patches which are stuck to the body, which monitor the blood sugar levels, and as indicated, as required, the insulin levels can be adjusted and pushed inside the body to maintain the blood sugar levels in the normal range. Monitor heart rate. Now, heart rates also are monitored with bands, especially when people are on the treadmill. Heart rate is monitored to know the extent to which you can exert. Abnormal heart rate affecting your respiration or your cardiac activities needs to be monitored to be within the healthy range of heart rate. Monitoring footsteps. This is now the recent fad, I would say. With the advent of social media, I walked 1,000 steps today. I walked 5,000 steps today. I will increase my steps gradually. Howsoever, this is something, it helps. It does help, of course, but I would rather say monitoring footsteps, for me, on a personal basis, it's not such a big thing. But these are devices which are used by every Tom, Dick, and Harry these days. It could be a social status also, with health bands on your wrists. Now we come to the challenges of AI. These challenges are generalized, not basically related to healthcare. Lack of trust. As I said at the beginning, any change is welcomed by resistance. Nobody likes change. Routine chal raha hai, chalne do. So doctor treat kar raha hai, karne do. But with the advent of AI, the lack of trust could be at various levels. Lack of trust at the level of the patient, at the level of the doctor, at the level of the machine company. Risk of bias. Data used to train AI could be inadequate, subjective, incorrect. Now, as I earlier, during the radiology slide, I elaborated upon that X-ray. The person was not standing properly, so the heart seemed to be oversized. The data was properly fed into the AI, but the interpretation is something which is not right. So there could be a bias in the interpretation of the data. Privacy, transparency. This is huge. Data is open for hacking, for leaking. And with medical insurance companies almost, like I would say, dangling with a sword in their arms, dangling over our heads. If the data is leaked or hacked, it can have gross, I would say, effects. Liability, accountability of AI-based solution failures. For some reason, the AI solution fails. Who is to be held accountable? The machine? The company promoting the machine? Or the doctor who has promoted or incorporated the AI? Or the institution where this test was done, the AI was used? Who is accountable? So I would say development of AI tools is a complex procedure. Once the tool is developed, it needs to be validated. Comparison with gold standards of diagnosis along with the clinical inputs of physicians will help to update the sensitivity and specificity of the AI tools. Bad data can be a big menace. One minuscule error and the outcome could be disastrous. So while incorporating the AI tools, one has to be very alert and not be completely dependent only on AI, especially in the health sector, I would say. And the last point, the potential job losses. India is a hugely populous country. With the advent of AI, there is a huge job cutting that has catastrophic effects on a person's life and on the society as a whole. So these are the few challenges which one comes across with the use of AI. Now I think I come to the last slide. Together we can. Gone are the days when there would be prominent divisions between the engineering and medical professionals. Now the lines have blurred. In fact, the lines have been broken at some places, allowing the intermingling and collaborations of both the professionals. Artificial thinking is one field where the coming together of experts, both the fields will benefit mankind hugely. And coming together is the need of the day, the need of the hour, in a global way, I would say. So I would like to end by saying that together we can make a difference, and love it or hate it, but artificial intelligence is bound to stay and bound to boom. Thank you. If anybody wants, anybody
Always ask. Participants, you can ask the query if you want to ask any questions, please feel free to ask. After any questions asked, the chat box, you can respond to them. I think either I have been very comprehensive or something which was beyond the comprehension. Whatever the picture, I think I call it a day. And thank you so much for your patience here, ladies and gentlemen. Thank you. Thank you so much, ma'am. So I take this privilege to deliver the vote of thanks to our esteemed speaker, Dr. Sadaf Khateeb ma'am. We extend our sincere gratitude for your insightful session on the role of AI in cardiology, pathology, microbiology, and some tongue twisters were there. So thank you so much, ma'am. And your talk not only created the awareness about medical conditions, diagnosis, and treatment, but also highlighted how AI is bridging the gaps of traditional approaches. So thank you so much, ma'am. Thank you very much. Thanks for the informative session.
Thank you. Thank you all.
Thank you, madam, for such a nice session.
Thank you, madam, for your nice deliberations. Really, it was a very amazing, innovative session, and we all have enjoyed a lot. Thank you so much.
Thanks a lot, madam. It's a very informative session.
Is any participants want to say? Yes, participants. Okay, thank you. Thank you all.